I'm back again. I'm here at CSA Medical Aesthetics. And for those who doesn't know me yet, I'm Rowena Laflin. I'm the Provincial Director of Mutia Pilipinas, Pampanga. About 2 months ago, I underwent a thread lifting procedure, and as many people notice, actually I received a lot of compliments that I look younger than my age, and thanks to CSA. And then I asked Dr. Contessa if there's still anything that she can do to improve more my face. And then she mentioned about this Korean V procedure, and I asked her if this is still applicable on my face, and of course she said yes, and that's why I'm here today, and we will do that Korean V procedure to make my face look slimmer and younger and beautiful, of course. Okay, and so stay and watch out for the procedure. Don't forget to click the subscribe button and the notification bell.
Good day, everyone. Welcome to the CSA Medical Aesthetics. And we have today a follow-up of Miss Rowena Laflin, whereby we did a so-called cog lifting on her. And Rowena, how was it?
Yes, of course. You know what, Doc? Yeah, I received a lot of compliments that I look 10 years younger.
Yeah.
And I think it's true, you know.
Yes.
The first time I came here like 2 months ago, and then I felt the effect like 1 week after Pamo.
Wow, that's amazing.
I saw it. Yeah, I saw it on my face.
Right. Yeah.
And
yes.
so here I am again for the, I think, another procedure just to follow up on that procedure.
Correct, yeah. Because in the past, we did the so-called cog lifting for Rowena, which is like lifting those saggy tissues. We wanted to restore that younger look, okay?
Yes.
And these are non-surgical techniques. And we remembered you were so busy that time.
Oh, yes,
there
I was
were
so busy.
activities. You wanted a procedure that's really has just a minimal downtime. And we have seen the results. Because actually I was following her social media accounts, her Facebook, and I can really see the big improvements. And a lot of people really noticed it. And they're really asking her, what did she do? What did you do to your face? You looked a lot younger. And still natural. The result is really natural. That's what's important, because a lot of us right now, we just wanted to do something subtle looking, but you see the rejuvenation, something that's gonna boost your confidence, right?
Right.
Of course, for today, we still wanted to do like a follow-up treatment again. Of course, we started already a rejuvenation treatment for Rowena. We wanted another treatment that will still improve the features of her face. Nowadays, a lot of people are still asking for like a V-shaped face. I have like clients asking me, Doc, what is the V-shape? How do you do that? And can I still do it? Like my age is like this?
Also.
At our age?
At my age.
50s? Can we still do it? Oh, I'm so excited, Rowena, for these kinds of treatments because they're non-surgical and we wanted something with less or as much as possible, no downtime,
downtime.
still very safe, and it still be you, not really making you look like retokada, okay? But still you, refreshed, younger, and like full of confidence, okay? What kind
Make
of
a big
treatment?
difference, yeah.
What are those procedures? We'll show you when CSA Medical Aesthetics return. And we're back. So for Rowena, we wanted to do a reshaping treatment. So Asian face, usually we are rounded, right, Rowena? So we have a round shaped face. So right now we have this Korean V-shaped face that is so trending nowadays. So at our age, like Rowena and I, we're both in 50s, we still wanted to reshape our face.
I thought that's only for teenagers now. I didn't know that we can do that at our age.
At our age also. So it's also following the so-called triangle of youth, the so-called inverted triangle. So for ladies, for women, on the lower part of our face, we want it slimmer. Okay, unlike men, they have a square-shaped face, right? For women, we wanted it narrower on the lower third of our face. So, for our treatment, if we wanted to slim the lower third of the face, so of course, you have to check the so-called bigonial width, this part here. And when we check this, we feel for the so-called masseter, the masseter muscle or chewing muscle. Can you bite, Rowena? So she has a strong chewing muscle. What do we do with this? We want to make it narrower. We want to slim or reduce the muscle mass. And the way we do it is the so-called injection of our botulinum toxin. So that is the Jotox, right? You've heard of that? So for this part on the bigonial width, you can do your Jotox here, okay? We'll be using Korean botulinum toxin for Ma'am Rowena. Of course, we've seen Koreans, right? And we've been watching Korean teledramas like that, and you can see their face, the ladies, they have narrow shape face, and they're using their own brands, their own products. So it means to say their products really work well, okay? And we've seen it amongst our patients. We use those too, and we can do that for Rowena. So for this part here, we'll be doing the so-called Jotox. Now, for this anterior aspect of the lower face, we wanted to slim it. So what do we target here? So actually, the nasolabial fat pad, the deep medial cheek fat pad, as well as the jowl fats. So we wanted to slim that. Right, Rowena? You also want that.
Of course.
So we wanted to slim those fat pads here. And then when we go to the center, the lower center part, the chin region, so Rowena already has a good chin volume. Now, what I will be correcting for Rowena is the so-called pre-jowl sulcus, and then the deep sulcus here, inferior to the lower lip. So we wanted to soften this part here. So you already have a good chin projection. So the treatments will be the Jotox here, and then the so-called mesolipo dissolve here, using our face V-line, and some chin filler, just correcting the pre-jowl sulcus, which is still part of our chin area, and also the deep sulcus here, to give that V-shaped contour. And we'll be using also our Ultraformer for reshaping the face and slimming the face. Okay, so we're both excited, Rowena, right?
Yes.
Yeah. So you've done already the cog lifting before, so all of this will be tolerable. Okay. We will be starting with our masseter. So again, your masseter here, the chewing muscle, it's located at this posterior part of the lower third of the face. Okay. So for that area, you have to really delineate your masseter. So in the past, we've been doing, like, for example, making a drawing here, okay? You can follow the corner of the mouth to your tragus of the ear, and then the inferior line here, mandibular line, and your anterior aspect of your masseter there. You feel for it. That's the anterior line and the posterior line here. So within this area, you can inject your botulinum toxin. You can do your 5-point injection technique, 3-point injection technique, or more than that. So for Rowena, we'll be doing the 3-point injection technique. So basically, okay, so you can numb the region with your numbing cream, And then I can use a botulinum toxin, okay? I'll be using a 30 unit per side. So the first injection point is gonna be 10 units. So it's just a quick procedure here. And then inferior to that, another 10 units. Okay?
Yes.
Yeah, okay lang po si Ma'am Weng. And then, the anterior part of your masseter there, so we'll inject a bit. And there you go. So, 30 units on one side. Okay, again, make sure you avoid the 1 centimeter at this part on the anterior masseter region, just to make sure you don't inject the rhizoius muscle there. Okay, next, the left side.
Wow, so easy.
Yeah, just an easy procedure, okay? So for our doctors who are doing this, you can still make your marking there. Okay, so I'll just palpate, so make a bite. And then I'll inject the first 10 units for this side here. And then after that, another 10 units. So I'm following the 3-point injection. Another 10 units here. And then inferior to that, another 10 units. Okay, and usually we expect result in a period of 2 weeks. Okay, so you're feeling that your muscular muscle is like reducing it in its size, and actually the contraction is being relaxed also. Okay, for those people with problems of PMJ or spastic muscles, they can make use of this kind of treatment. Now next is the so-called Ultra V face line. What is V face line? This is made up of fat dissolving solutions or lipolytic solutions. So they target the fat tissues, so it's gonna help in reducing those fatty tissues, okay? So for Ma'am Weng, we'll be working on the mandibular area. So we have jowl fats there, and then the deep medial cheek fat pad, we can also target it, and also the nasolabial fat pad, okay? You still okay, Weng?
I'm okay.
So this is already the second treatment. So for my face line, I'll just be doing a linear threading approach. So what I'm gonna do is just do this linear pattern here, series of my injections there. So a linear pattern there. You can target the subcutaneous layer, the superficial fat layer. So make a line like that. For our doctors who are doing this, you can do like a step ladder pattern for this one. So I'll work on this superior jowl here. So it's just a serial pattern, a series of linear patterns, okay? And then for my nasolabial, so we wanted to reduce those fatty tissues and improve the shape of the face. And last one here. So it's just a series of lines like that, linear threading lines. They're parallel to each other. So same thing on the other side. So of course for our injections, expect some pinpoint bleeds there. So this is already the second procedure that we're doing. This is the so-called face V line. So we wanted to reduce the fatty tissues. So I'm actually in the subcutaneous layer, targeting the superficial fat. So you can also target your deep cheek fat pads. Okay, for our doctors, they know the anatomical plane for the deep cheek fat pads. So some have this buccal fats here. You can also direct your fat dissolving solution in that anatomical region there. So we're almost done. So I'm using actually a 3 cc per side. And there you go. So that's the second treatment. Okay, you're still good?
Good.
Okay, so for the third treatment, we'll be doing the so-called dermal filler for the chin region. So since she has already a good volume on the apex part, I'll just be working on the pre-jowl sulcus there. So I'll be using a hyaluronic filler, okay? And I also wanted to correct the marionette line here. And now I'll be doing the cannula method. So for the cannula method, I'll make a puncture point here as my entry point. Okay. So we have to be very careful in this region. We know we have our facial artery branches here. So I'll be using a cannula just to be very safe. So I wanted to correct the marionette line here also. Okay, I can direct my cannula towards this side here. So actually, the last cog lifting that we did, we also wanted to improve the marionette line. So we combine also hyaluronic filler for correcting our marionette line. So this is now the part where we are doing marionette correction. Okay, so this is a filler with the lidocaine. So I've filled in this part, and then I'll go to the inferior part where I have my pre-jowl sulcus. So just glide your cannula towards that pre-jowl sulcus there. You can already improve the sunken part in that area here. So that's so-called pre-jowl sulcus here. So a slow push, gradual push, you're just filling in this area here. Okay, so I'll be using half mil on this side, and then I'll be moving to the right side. Okay, so that's half mil, and then let's go to the right side. Are you still okay?
Easy.
Yeah. So this one here again, entry point. So I have to be very careful in injecting this or making a puncture point here, because we have the facial artery branch here, which is actually deeply located. When it goes near the alar, it's becoming superficial. So I have to be in the upper layer here to avoid the facial artery. Okay, so it's a matter of proper placement of your material product. As long as you know the anatomical layers, you are in the safe zone. And then I'm correcting also the marionette here. I'm using a half mil of my hyaluronic dermal filler. So this is to improve the marionette line here. So it's like a fanning technique, okay? Gliding my cannula towards now the pre-jowl sulcus. Okay, you're still good. So I wanted to correct this marionette line too, and the pre-jowl sulcus as part of our chin improvement or lower part of the face improvement, lower third of the face treatment. Okay, so we're gonna direct it there, and then we finish with the half mil syringe. Okay, so just gliding it. Of course, initially you'll feel some resistance there, and pushing more until we correct that pre-jowl sulcus there. So you can inject in this pre-jowl sulcus like a bolus of your filler. So there are areas whereby we inject little amount, there are areas we inject like a bolus amount, so it depends on the anatomical region. So the hyaluronic helps in restoring volume and also hydrating the tissues, and you know hyaluronic is hydrophilic, so it attracts water and improves skin turgor also. So I'll be using 2 syringes for you, okay? Yeah, more better. So this is still part of our, so I'm following now the vertical line here, so I'll make another entry point for that one. So for areas that we're treating, we create another entry point just to reach this part here. Okay, so I'm improving this deep sulcus here to somehow lengthen a bit the chin as part of our V-shaped face. Okay, so I'll be using a minimal amount there. Okay, there you go. And then let's proceed to the left side. So another entry point. Okay, so just a cannula technique, it's safe, it's not a needle. And then after this, we will be proceeding to the so-called Ultraformer, which is a device, ultrasonic device for also lifting, skin tightening, firming, rejuvenation, as well as of course reshaping the face, contouring the face, or if you want to achieve a Korean V shape also, you can achieve it with that Ultraformer. So that's the final treatment, Ma'am Weng. So others are asking like what is the sequence of your treatment. So it will depend on the anatomical region. Of course, if we did already injections on the posterior masseter, we injected the chin, we'll do the Ultraformer just on the part of the lower face where we wanted to target some of our fat pads there. I usually inject the mesoface fat dissolve first before the machine because when you do the injections first of those mesofat dissolve, then you do your Ultraformer, it gives like a so-called acoustic wave. Like it still help the product spread into the entire fatty tissues. So okay, I've done masseter injection of botulinum toxin, face V-line, and a chin filler. We will proceed to the Ultraformer treatment. Back, so we'll show the results to Rowena.
Yes.
Okay, here's the mirror, Weng.
Mirror on the wall.
So
wow.
we did Botox. We did also the Ultra V face line for.
I like this part.
Yeah,
You know.
for the fat dissolve.
Yeah.
We did also the filler, marionette, and in the deep sulcus of the chin part. And then the Ultraformer for further lifting and reshaping the face. So actually, with what we've done right now, we still have to wait for the effect of the face V-line, the effect of the Botox. But of course, with the filler, you're seeing already improvements.
Yeah.
And then also the Ultraformer, you'll further see results. Then actually, we'll be doing like a follow-up, like a monitoring of what's happening, like a week or 2 weeks. We'll be showing, of course, those results to our televiewers. So we will be following you, Miss Weng, on your social media account. Whenever you post your pictures, we'll be seeing more improvements, and it's gonna be making you look a lot younger as days, weeks, months pass by.
Okay.
So any comments, Ma'am Weng?
Wow, you know, with this effect, I can see it already.
Yeah.
Huh?
Yeah.
So,
Noticeable already.
it's noticeable and it's tolerable, the pain. This is nothing for what I did last time.
The last time, the pug lifting, that's understandable, yeah.
Oh wow, look at that, see?
Yes. The fresh look, okay, rejuvenated look.
And of course, the self-confidence is there.
Exactly.
You know,
And you'll
like
get younger and younger actually, Weng, huh? You haven't really seen the full effect of this one. We've just done it now. Okay. And then the face V-line, it depends, okay? Some people, we do it in sessions, like every 2-week session or every 4-week session. It will depend on how much of the fat tissues will still remain. As well as the Ultraformer. Ultraformer, you can lift it after 3 months or 6 months. It will depend. So it varies, it depends on the individual, okay? So this one is natural result, okay? It's very safe, and it's just making you look younger in a natural way, okay? And of course, it really has a great impact on your, you know, your personal life, your
exactly.
daily lifestyle, your social life.
Like, especially when people start to notice you.
Yun.
You know.
Right.
Parang, it's worth it.
It's
That's
worth
it.
It's worth it.
Yeah, it's worth
and
it.
And the thing is, these kinds of treatments are affordable, okay, as compared, because in the past, Weng, we've done yung MASJ Perfect V. But we use products that are European products.
Okay.
So, the MASJ, it's, of course, ibang brand yun eh. But the brands that we're using are really affordable right now. Yung sa Botox natin, yung chin filler, yung face V-line, Ultraformer, they're very affordable. They can just like email us or send us like an inquiry at our FB page. This one is like affordable. So for those individuals who wanted a treatment that, of course, within their budget, this is the Korean V-shape, okay, for our age. For now, of course, we'll still check yung result ng pag-V contour. Okay, yung right contour lang po. It's not really naman parang gano'n na sobrang haba na here, tas parang gano'n na hindi na natural looking. It's more of a natural way na ano lang talaga, the right shape ng lower face na balanced to the entire shape of the face of Rowena. Of course, you have to consider the upper and the middle third also. So it should be within the ratios and proportions, right? So it's like following lang yung Korean V technique lang that we call it. Okay, thank you, Weng.
Thank you.
Another learning today.
Yes.
Another like like enlightenment, okay? And of course, we hope we're able to help a lot of our televiewers because we've been receiving messages saying that some of them have these insecurities.
Right.
It's been their problem for a long time. Others are sharing with me, nabubully yung iba, or self-esteem, self-confidence is so low.
Yes.
Or the others have like marital relationship problems, no? Like their spouse is looking for other women who are younger looking or prettier
Oh
than
my
them.
God.
So hopefully we're able to help and share informations with you. And of course, we wanted also treatments that are very safe, clinically proven na talagang effective. Okay? And we wanted also to, like, of course, give a treatment na affordable. I understand kasi the others were saying some treatments are really expensive. It depends on the brand. Nag-iiba po kasi yung brand na ginagamit. So, we have these kinds of Korean products that we can afford. And good thing, we're able to give these kinds of information to our televiewers. Okay, thank you, Weng.
Thank you also. And to add, of course, by just merely going to see Dr. Contessa, you're in good hands.
Yes, thank
Okay,
you.
on
Kasi
top of that.
pinag-aralan natin yan. Matagal natin inaral. We continuously study and improve our skills.
You
Okay?
feel safe.
Yeah. So if you have any questions, you may email us at csaskinclinic@yahoo.com, our FB page CSA Medical Aesthetics, Instagram CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. If you want to see the episode of Ma'am Weng, the one we did cog lifting, you can check our YouTube channel, Contessa Salvador Alapag. Okay? God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.